Why are about half of Americans opposed to new health care reform legislation? Well, that's exactly the question we asked over the weekend. Let's go down the answers to this open-ended question. First concern, big government. A lot of Americans, in fact, when we add up all the categories, over a third of Americans say they object because it would mean too much government involvement in medicine or socialized medicine. What comes after that? Well, 14% of Americans who oppose a new health care law say it's because they simply don't understand the legislation or they want more clarity before they would move to the point where they would favor it. Other than that, cost is a concern. We had 17% of Americans who said in general they were worried it would raise the cost of insurance or that it would cost the government too much or just be too much government expenditure on health care. One thing I should point out is we had relatively few Americans who said they oppose health care legislation because it wouldn't benefit them personally. Most Americans are concerned about more global issues than just how it would affect them one-on-one or their family. What about the half of Americans who favor new health care legislation? Well, by far, the dominant reason given by Americans for favoring it is that it would extend health care to people who currently don't have it. In fact, when you look through the list of reasons given by those who favor it, we find a lot of mentions of what we might call charitable reasons. People say it's a good idea to extend health care legislation to those that don't have it, and also people specifically mention groups like the poor or senior citizens, that they too would need health care insurance and coverage which would come from health care reform. Bottom line out of our analysis of these open-ended questions which probe why people favor or oppose a new health care law, opposition focused a lot on worry about government and cost. Those who favor it focused really on the charitable aspects of a new health care reform law and how it would expand insurance to people who now don't have it. I'm Dr. Frank Newport, Editor-in-Chief of the Gallup poll.